Hello, my name is Sarah McGee. I am the Head of Service for Children's Mental Health and Emotional Wellbeing. The Child and Adolescent Mental Health Service has continued to see a significant amount of young people during the COVID-19 pandemic. That said, we've had to change and adapt our delivery of service in a way to protect and support staff and equally protect and support the young people who are in receipt of our service. I'd like to take this opportunity to say thank you to the commitment and dedication shown by CAM staff across the Trust. They have worked tirelessly in the last number of weeks to continue to provide a safe and responsive service in a very uncertain and unpredictable time. And equally, a thank you for the patience and understanding shown by our families who are involved with our service. We are really mindful that when the outbreak of the pandemic, there was a significant number of young people who were new to our service, involved with our service, and at the point of transition to adult mental health services. We are very mindful of the interruption in your care at this time. At the heart of the CAM service is the development of therapeutic face-to-face connections where we can afford young people a safe space where they can express their worries and fears to us. As a service, having to think and rethink how we do our business has been a real challenge. We are very mindful of working in tandem with young people to see what they need right now. We are also thinking about ways that we can care and support for you in the future. This may take the medium of more telephone conversations. It may also take the medium of visual platforms. But we will work in tandem with you and be guided by you in what is going to be best to serve you. We're also very mindful of the young people who are on our waiting list. We are very aware of the distress that this causes for young people who are waiting for appointments. We have made a commitment to look and think on how we are going to address that. We are working hard to be in contact with you and support you also at this time. If you, or as a parent, are concerned about the mental health of your child, please do not hesitate to contact your GP, who will afford onward referral to the most appropriate service. Thank you.
Hello, my name is Jane McLaughlin and I'm a consultant clinical psychologist working in the CAMS team. This week is Mental Health Awareness Week, and the theme of kindness is very fitting at this time. We are currently managing the coronavirus pandemic and the impact this has had on the lives of our parents, children and young people across all of our communities. At this time, we are all negotiating the changes this has brought to our lives in terms of contact with family and friends, our school lives, our working lives, and access to things that we enjoy, such as socialising and hobbies. It is important to be aware that each of us will have our own individual responses to the coronavirus, and this is based on our own individual circumstances. It is important to be kind to ourselves and show compassion to ourselves as well as to those around us. We need to look after and nurture our own emotional health and well-being to enable us to look after our children and young people. Simple everyday things are most important at this time. This includes trying to keep routines in place such as meal times and bedtimes, trying to do a small amount of exercise each day, and speaking with friends and family. We have provided some links below to additional resources which may offer further support at this time. Take care and thank you.